You're still dizzy? Let's talk about different type of dizziness, which is lightheadedness. That is very common and patients complain about. With lightheadedness, the patient feels as they are about to faint. Their head is not clear. They're living in a fog. Almost sometimes they describe it as they're living underwater. There's no spinning sensation inside the head or around the patient. In this situation, lightheadedness usually related to the heart or blood pressure. So there's a specialized nervous system called the autonomic nervous system that supplies the heart and supplies the blood vessels. So when the patient is in seated or laying position and they get up fast, the blood pulls to the legs because of the gravity. So this autonomic nervous system kicks in. So it causes the blood vessels to constrict, and it causes the heart rate to increase. That pushes the blood from the legs to the brain and pushes more blood from the heart. The idea is to maintain good blood flow to the brain, so the patient does not feel dizzy, lightheaded, or faint. So in certain patients, this system fails for whatever reason, or it could be not sensitive enough to respond to changes in the position. So that's why when they change position, the symptoms occur. And at times, if the lightheadedness is continuous in all positions, then it could be systemic problem. It could be deficiencies in certain vitamins, minerals, or anemia. So typically we get a cardiologist involved in those patients. They do an echocardiogram, EKG. Sometimes they even do a Holter monitor at home. We check orthostatics, where we check the blood pressure laying down, sitting up, and standing up, and see if there's a changes or fluctuation in the blood pressure. So at times, if the lightheadedness is continuous, we might order some blood testing, and at times we might even order a brain MRI to see if the brain is okay too or not. So the treatment, if it is a simple orthostatic hypotension, changes in blood pressure causing the dizziness or lightheadedness, we advise the patient to increase the fluid intake, salt intake. We also advise the patient to change position gradually rather than abruptly. Allow time for this nervous system to kick in. So when you're laying down, you sit up for 2 minutes, then you stand up too slowly. Lean on something if you feel like you're lightheaded. Go back and lay down if you feel like you're about to faint. And in certain situations, if the symptoms are very severe, we might also rely on some medications. So just make sure to differentiate this type of dizziness or lightheadedness from other types, and give the information to the physician to confirm the correct diagnosis for you. Thank you.